This webinar. My name is Mona and I am the host for this webinar, which is titled Sleep for Success, Empowering Parents of Autistic Children with Sleep Disorder. My main objective here basically is that I empower parents with practical strategies to promote healthy sleep patterns in their autistic child, and I hope to do that by improving parent skills. I'm going to educate parents about sleep disorders in autism. I'm going to talk about actionable steps that parents can implement to promote healthy sleep patterns in their autistic child. I'm going to make them aware of principles of good practice in autism and tell them about why a personalized approach is considered to be the best approach, and then also educate them about parents' own well-being. I think that's something that often gets neglected. I'm going to begin with sleep disorders in autistic children, give you an overview of the prevalence rates as well as the challenges involved. Then I'm going to talk about what causes sleep problems in autistic children. Then I'm going to touch upon evidence-based sleep management strategies, give you some practical tips, and yes, the most important part is the principles of good practice in autism intervention. Now, you may be wondering that how common are these sleep problems in autistic children? They are quite common. The prevalence of sleep disorders in children and adolescents with autism is approximately 60% to 86%. I just gave this figure of 80 because that is what most of the research studies were approximately coming up with. So this percentage is 2 to 3 times higher than that of typically developing children. So a typically developing child would have, the sleep issues range from 3% to 36%, whereas here more than 3/4 of autistic children will have a sleep problem. So this means that it's very prevalent. Then we have so if it's prevalent, does it mean that do these sleep challenges vary with age? Do they shift over time? Well, the magnitude of these sleep problems persist throughout childhood. However, the type of sleep problems experienced changes with age. So preschoolers and school children who are in primary years, they experience problems with sleep anxiety, with night waking, with resistance at bedtime, resistance to go to bed. And as they grow into adolescence, we find that they experience reduced sleep duration, they sleep for less time, and then of course that leads to daytime sleepiness. So the magnitude persists, but the problem remains throughout the childhood. And when it remains throughout, what is the impact then? What kind of challenges does the child and their family has to face? Well, sleep disturbances can affect behavior and emotional regulation in children. Children with autism experience, when they experience sleep problems, it can worsen their autistic characteristics. So their social communication may be even further compromised, and the way they communicate would only be through, something called extrinsic behaviors like meltdowns, tantrums, hurting themselves, or hurting the infrastructure, and then they would have a lot of hard time understanding their own emotions, and they would never be able to understand other people's emotions as well. So if you as a parent are trying to make them understand that this is causing a lot of trouble, they may not understand that. So apart from this effect on mental health, their physical health gets affected, their immune system gets impaired, they may gain a lot of weight, and the parents also get affected, right? Their sleep quality and duration is affected, and because of which they don't have that emotional well-being left anymore. They don't have that capacity, that patience to support their autistic child who's undergoing a lot of emotional dysregulation, and that can lead to an utter chaos, like a vicious circle where the child is not sleeping well, leading to these challenging behaviors, which is the lack of sleep and behaviors are affecting the parents' own sleep, and they don't have the capacity to support their child, and then this keeps on going perpetually in a circle. So it is bound to destroy the family dynamics, like other siblings. The environment in the home can be disturbed a lot, and even if the parents are working, their work dynamics would be affected. So the challenges are quite grave, and that's why it's really important that we have these seminars where we are able to give advice to the parents on how they can treat sleep disorders in their autistic child. So these are some of the terms that are used for sleep problems, for various types of sleep problems in autistic children. Insomnia, it is actually said to be the most commonly found sleep problem in autistic children, and it includes difficulty falling asleep, staying asleep, etc. Parasomnia would be if your child is having nightmares, is vocalizing during sleep, is sleepwalking, and if your child has some movement disorders like restless leg syndrome, and if they're banging their head, the teeth grinding. So if they're spending the night doing these things, then obviously they would be quite restless. Circadian rhythm disorder is when the autistic child's body clock does not tell them when it is time to initiate sleep. Normally we all have a body clock which is it impacts our sleep patterns, it impacts our many other things like cognitive performance. But when that body clock is disrupted, then it can lead to sleep disorders and other health issues. Mood disturbances can happen. So why do sleep problems happen in autism? When the problem is so grave, let's also discuss the causes. Well, research has not really been able to clearly identify the causes of sleep disturbance in autistic children. What they have done is research has come up with many factors that are said to are correlated with sleep disturbance. So number one of them is like inherent in autism. Sleep disorder may be inherent in autism. We know that our children with autism, they find it a bit challenging to communicate, so they may have trouble understanding bedtime behaviors. They may not always know what time they should what they should do before going to sleep, like brushing their teeth or getting to their pajamas. And it has been noticed that parents often get frustrated that the child is not understanding their expectation of going to bed on time. The child is not understanding getting ready for bed independently. Well, that's because the child doesn't have trouble because of their challenges with communication. They have trouble understanding these kind of behaviors. It may also be some environmental and behavioral problems. So, for example, the child may have adopted a habit from the environment, for example, like excessive screen time just before going to bed, or they may be dependent on carrying out certain rituals before they think of sleeping. And then parental influence. If the parents don't have enough good sleeping habits, then of course it's going to create a negative environment for the child to sleep as well. So the parents may belong to a low socioeconomic group. So if they have low levels of income, if their education is low, they may not be aware of positive effects that good sleep can bring. And when they're not aware, they may not practice it themselves, and that can lead to sleep problems in autistic children as well. So something related with autism is the arousal dysregulation. Arousal dysregulation is basically is when our bodies are, they're having a hard time getting ready for sleep or calming down when we need to relax. So they are very excited, and it's very challenging for autistic children to make them to slow down and to get ready for bed. Sensory dysregulation is found in almost 97% of autistic children. So basically what it means is that the way our senses work, like seeing, hearing, touching, tasting, and smelling, they may not work with autistic kids. So there may be that their senses can feel too sensitive, or they may not be sensitive enough. So if they're having a sensory overload, that would mean that anything like a small sound, a small flicker of light, even the feel of a bed sheet can become quite uncomfortable or distracting for your child, and it can make them really hard to sleep. And if hyperactivity, if they are quite restless, there's a strong need for movement for them, that can also create restlessness for them, and that can make it difficult for them to drift to sleep. Co-occurring conditions are so common in autistic people. So along with their autism diagnosis, there may be some other conditions that are present in the autistic child, and that can make it quite difficult that can, again, it can be related with sleep problems in the autistic child. So you may find that your child has a lot of mental issues. So he or she may have anxiety, depression, they may have attention deficit that can negatively affect sleep. They may have asthma, because of which they can't sleep, breathe properly. They may have some allergies. They may have gastrointestinal issues, which is all these medical disorders are preventing them from having a good sleep. So the reason why I've talked about all these, so these are some of the factors that I've listed here, and the reason why I've talked about these factors is that it's really important that parents are given that knowledge to discuss these factors with their healthcare professionals. Most of the times we tend to blame it all on the autistic child, but if you're aware that maybe it is something to do with the autistic characteristics, maybe it's something to do with the environment that we are in. So that enhances the overall understanding of the child's unique situation, and that can help the healthcare professional to come up with a more personalized strategy to address sleep disturbances. So after discussing how challenging sleep disorders are, we talk about the sleep treatments, sleep hygiene, healthy sleep practices. I'm not talking about giving them some medicine. Research says that if you are the first line of action is trying to incorporate healthy sleep practices, also called sleep hygiene. So making sure that your child has a consistent time when they go to bed and they wake up, making sure that your child has a conducive sleep environment. It is calm, cool, and dim, and making sure that they don't have exposure to screens 1 hour before sleep. They are not that, they don't take any energy drinks, they don't eat within half an hour. So all these basic sleep practices can help. And then there are some evidence-based behavioral sleep strategies. So for example, bedtime fading. So if the child is taking more than 30 minutes to fall asleep, as a parent, the parent can set this time, the child that is usually falling asleep, as a temporary bedtime, and then bring this bedtime earlier by 15 minutes every few days until the desired bedtime is reached. And then we have something like camping out. So if your child is anxious, we can, the parent can camp in a chair, then gradually move further away each night. And by third or fourth night, the parent can just, continue to move outside the bedroom until the child falls, and the child should be able to fall asleep. And then we have rewards. So if the child is showing desired sleeping behavior, the reward can be that they can be given an activity that they enjoy, or stickers or stamps. But care should also be taken to ensure that children are not inadvertently rewarded. Like, do not give them access to screens, say for waking up too early. So then we have visual supports. They are so common in other therapies as well, and research has found that it can be a good way of introducing your child to a good sleeping habit. So through the use of visuals as well as text, you're making use of these social stories and telling them what a good sleep habit is about, when should it be done, how should it look like. So this can really help autistic children understand the importance of good sleep hygiene. Then it's very important that parents are aware of good principles of good practice, which is that parents need to give consent for any kind of strategy that I've discussed before. And your child has the right to say no to support or therapy if they're not comfortable with it. And if your child's, if the therapy has to be according to your own family context, and as I said, evidence-based. So for parent training, it is important that for their own well-being, they can practice mindfulness, because that helps in increase in feeling of parental sense of competence. And instead of feeling bad, they can come up with what their parental values are, and then commit to action, how they will act according to those values, and that can bring flexibility. This is called ACT. So these are some free resources, and these are some points to remember. You have to practice these strategies consistently. Practice mindfulness every day, even out of the training hours. And so my practical tip last is that that sleep routine that works for your child is the best routine. And that's my take home message. Thanks for listening. Lisa Amar.